Hi, everyone. I'm Deena. Just this? Oh, okay. I'm Deena Sukhon. I'm a second-year medical student here to present on patient experiences to improve female hernia. Okay, got it. Thank you. Our only disclosure is that our study was funded by SAGES. So what do we know? Thousands of females get groin hernia every year, yet they've been excluded from every prior trial. So we want to fix that by starting those trials. And why is it important? Because females face worse outcomes. That's what the research shows. And so we want to be part of those trials, but in order to do that, we need the preliminary data that will tell us how to conduct those studies the best to improve those outcomes. And so to do this, specifically, we're going to engage with patients to understand their experiences and elicit research priorities. I did this by conducting interviews with 34 females from our academic medical center, and then used inductive thematic analysis to come up with 3 dominant themes. And so who were those participants? We had an average age of 64, majority were white, of the white race, and then majority underwent surgery prior to our study. And so these were the dominant themes. We noticed challenges in hernia diagnosis. So this is things that patients felt like delayed diagnosis or misdiagnosis because female hernias were underconsidered, similar to management and treatment. And then we tried to elicit future research priorities from the patients themselves instead of just making our research priorities considered. So our challenges, we heard a lot of challenges of hernia diagnosis, and we even heard from healthcare providers that this was something that they didn't even think of. So I think it took a really long time for people to think about a hernia. I strongly feel that this is because I'm a woman. Even the PM&R doctor ordered an ultrasound of a completely different area. I mean, it's like nobody is actually thinking about it in women. I really feel strongly about that. And this wasn't the only healthcare provider that said the same sentiment, that it was just not considered. If I would go back, I would have played a bigger role in getting immediate attention. If I look back on it, I'd say that I didn't suspect it was a hernia, but I knew that it was very localized. I knew it was in the appendix area, so I was thinking, oh, maybe an appendicitis. So you can see, like, if people in the healthcare field are believing that this is underconsidered, you can imagine how people outside of it feel as well. And so we also had talked to the participants about hernia management and treatment. And although some participants did agree with the surgery because that's what their surgeon recommended, some people felt like they knew better, like this participant. And so I just learned to, I don't feel like the doctor is, he's not like the king in making the ultimate decision. You know, he doesn't know everything. He can learn like the rest of us. And so I'm just educated in my own mind. I feel like the doctor is another, stupid person. And so I feel like I'm making the best decision for myself, and I can take his recommendations. You know, they're recommendations at the end of the day. So that quote is kind of hard to read in front of doctors, but it's very important to show that shared decision-making is desired by these patients. And then another participant mentioned that even the things that were recommended by their surgeons were hard to find. Even the product, it's interesting. You know, they have like hernia belts and things like that you could use, right? If you're waiting for surgery, they're all designed for men. If you go on Amazon or try to order something, literally every picture is of a man. So we also wanted to know what they found was important for us to research. This first participant said, I did have a baby at 16. I would be interested to know how many people are born with these things. If these things happen after childbirth, if they only did studies of men with hernia, that's not helpful to women that have children, because when you have to push those babies, can you imagine? You're probably making hernias at the time you're doing that. And then a lot of patients brought up this histrionic female bias in general. Well, I know that there's a historic issue of within medicine, like across the board, not listening to women when they're in pain. And I definitely feel like I experienced a little bit of that. So in conclusion, our study really shows the need for sex-specific care, and it shows that our approach to doing that is by incorporating female patient perspectives in future trials. And so even without the clinical data, we saw this huge gap in the patient and provider education. So that's our first step of trying to improve that gap, and followed by more sex-inclusive hernia studies. And yeah, before I end, I'd like to say thank you to Dr. Allers and the whole core team. Thank you.